A little breath, just completely empty. Hello, beautiful people. Welcome. There's nothing you need in this life, but let's talk about the superficial stuff for a couple minutes. Hello, beautiful people. You are beautiful the way you are, and you don't need any of this. And of course, we can talk a little bit about beautification, because if you're doing it for your soul, it's all good. All right, let's talk about botox, dysport, xeomin, jeuveau. We have all of these different agents here. Basically, they help with fine lines, wrinkles, and slowing down the aging process. So I'm totally due right now. So take a look here. Frown, the 11s, raise my eyebrows, come all these lines, and then around the eyes. Those are the top 3 areas that most of us get treatment. It's all preventative. So you want to get in on the earlier side. The sooner you start, the less lines you have, and over time, the less difficult it will be to take care of it. Because once the lines form, it's a little bit more difficult to take care of. So, commonplace is the frown area. That's where most people start, and it takes a certain amount of units, and you let us take care of that. You don't have to worry about that. Price-wise, it's all about the same in our practice. It doesn't really matter which of the different agents you choose. Of course, I have a certain preference, and then we can always discuss that during our consultation. So if you have any questions, just come on in and we can take care of you. Is it gonna hurt? Oh, nothing is forever in life. So even if it is going to hurt a little bit, it's just a tiny bit, and it's a short amount of time. And it is like a 1 out of 10. It's like the tiniest little needle, and it's over before you know it. So it's not a big deal at all. So that's as far as discomfort. Okay, how long is this gonna last? It's gonna last anywhere from 2.5 to 3 months. If you've done it for the first time, probably on the lower side. If you have been doing it for a while, it could last you a little bit longer, because these are all muscles. And if we're not allowing the muscle to move, you're basically not allowing the muscle to go to the gym. And what happens to a muscle when you don't go to the gym? It atrophies, it gets smaller over time. And so if you do it every 3 to 4 months and you keep up with it for about a year or 2, what I've seen is that it will last you a little bit longer. And in some cases, depending on your metabolism, depending on some other external factors, you may actually not need as much as you initially started out with. So that's a good thing. So keep up with it if you can at the beginning. All right, let's talk about aftercare. We usually say no vigorous exercise for 24 to 48 hours. Definitely don't get any facial treatments on the area that you got treatment, because we don't want the medicine to move. We want it to settle out in the first week or 2. Secret, I've done everything that I tell my patients not to do, and I've been fine. So the risk is pretty low. When you come in and you're getting this for the first time, you get a consultation with myself or one of the other providers, and then we decide what your goals are, what you want to achieve, and what area you're interested in treating. After that, we come up with what type of product you want to use, and then how much we'll recommend to use. And then once you give us the go-ahead, we go ahead and do it. And then the treatment itself is maybe 10 minutes or less. And you get a little block of ice, and it's cute, and you put that on your skin, and that can help with kind of numbing the area. And then, not that you need it, it's very simple. And then you're good to go. Most common areas that people get treatment on is the frown or the 11s, the forehead, and then around the eyes. There's some lower face Botox and dysport that can be done as well, which is the DOA, helps with turning up the mouth, as well as some of the lip flip that we do to expose more of the color of your lips, as well as reducing some of the fine lines on the top and bottom lip. What other areas? Around the underneath the eye, we sometimes can give small little blebs to reduce wrinkles over on that area. Those are the most common areas. Oh yeah, one more. It's a big one. Not everyone is a candidate for this, but masseter muscle. So some individuals have bigger masseter muscles. So when you squeeze down real big, you'll see a big bulge over here. Some people grind their teeth. That can be uncomfortable and it can actually cause jaw pain. So what we do in that situation is we inject the area with dysport or Botox, and that reduces. It does two things. It helps with discomfort, but it also helps with creating a more aesthetically pleasing upside down triangle in the face, and it's more feminine looking for our clients. So those are some of the other areas that you could consider getting these types of treatments.